Hello dear candidates. So today we will study the management of different types of the headache. So the first one is suspected meningitis, right? In suspected meningitis, you have to after telling the diagnosis, simply tell them what is meningitis. So it is the inflammation of the protective covering of the brain and spinal cord, right? uh, it can be due to the bacterial infection, and tell the patient that the symptoms you are having, such as neck stiffness, fever, all these, so they were due to the bacterial infection or the inflammation of the covering of the brain. Tell them that it is a medical emergency and we have to treat it very immediately, right? And you have to start the treatment as well. So in the treatment, the first one is benzyl penicillin. You have to give them and give into the muscles even before shifting the patient to the hospital, right, to the emergency department. So you have to arrange the ambulance, right? And there should be no delay in starting the treatment. And once the patient is shifted to the hospital, in the hospital different tests will be done, such as lab tests, such as blood test, infection markers, clotting profile, uh, or different organ function test will be done, right? Then CT brain will be done as well. And after that, a confirmatory test such as lumbar puncture. You have to mention the lumbar puncture, right? So lumbar puncture will be done. Tell them that it is the test, it is to test the spinal fluid, and it is a confirmatory test, right? In the hospital you will be given antibiotics through vein, right? And you will be given painkillers to relieve the pain. You'll also be given steroids, right? Since meningitis is a notifiable disease, so you have to notify the public health. In public health, you have to mention that local health protection team will be notified as well. You have to tell them that will give treatment to the closed one as well, even if they are fine. So mention the drugs such as ciprofloxacin and rifampicin, right? Also tell them, guide them for the pre-travel advice whenever you travel to such areas. So seek pre-travel advice. It can be vaccination or tablets to prevent serious infections, right? Then is safety netting. So safety netting, tell them that in ambulance, if you if you have any serious symptoms such as severe nausea, vomiting, severe pain, or any seizures, like, so you have to inform the health team. Then is follow up. For the follow up, you have to tell them that you'll be given medications as well. And tell them that if you face any severe changes in your hearing or neurological symptoms, so you have to seek medical help. And in the last, give them the leaflet, right? Then is the cyclical migraine. So we will just simply, you have to tell them that what is cyclical migraine. So tell them that it is a headache due to the natural drop in the estrogen, or the natural changes in the hormone during the or before the period, right? So you have to tell them that it is a natural this is a natural drop in the estrogen, and it then affect the blood vessels, which can trigger a migraine in some people, right? Then is the for the management, tell them that prescribe you the sumatriptan, nasal sumatriptan, right? It's just in the form of spray, and you have to take them 2 days before the expected period, and continue it for the 3 days after the bleeding starts, right? Then is advise them for the diary keeping, and tell them that you have to maintain a headache and period diary for almost 2 to 3 months, right? And you have to record the start and end of your headache, start and end of your periods, and the medications taken during this migraine. Actually, this diary keeping is very important, as it helps us in the confirmation of the diagnosis. Once the cyclical migraine is confirmed, so then you have to give them the, for the future planning, you have to give them the combined oral contraceptive pills or estrogen patches, right? It will prevent the hormonal changes or hormonal drops, and it will prevent any further uh, migraines, right? Okay, also give them the a general advice that whenever you are having a headache, so sit in the dark room, rest in the dark room, right? Stay hydrated, drink plenty of fluids, avoid bright light and strong smells, right? Then tell them for the safety netting that during the migraines, if you are having any severe nausea, vomitings, any changes in any neurological symptoms, seek medical help, right? For the follow-up, you have to tell them that we will review you in 2 to 3 or after 2 to 3 cycles. You have to come along with your diary, and we have to confirm this cyclical migraine and give them in the leaflet in the end. You will tell them that you will give you a leaflet. It will contain all the information about the cyclical migraine. Read it to it, right? Thank you.